You are listening to the Dr. J Talks podcast. What's up, Dr. J Talks podcast crew? I am your host, Dr. J Thompson. I am excited to be launching my first live podcast episode right here in Elizabethtown, Pennsylvania. And boy, I cannot tell you how excited I am. I appreciate my listening audience and thanks for your support. You can follow me, hashtag Dr. J Talks. Email me, drjtalks@gmail.com. Make sure you check out my new website, www.drjtalks.com. And also, if you would like to support the Dr. J Talks podcast, please hit me up on my Cash App, $ Dr. J Talks. And you can go to my website, scroll down to the bottom, and you can find information how to support the show. So my vision is really simple. People often ask me, Javon, why did you finally decide to start a podcast? It initially was not something I really wanted to do, but I thought about it. The more I talked to myself and said, Javon, you should really highlight those people who are protecting and serving in the public. And it was really a no-brainer after that. So my vision is quite simple, and that is to glorify God through healthy conversation and to provide a learning experience for my listening crew. So with that said, I am bringing to you an interview-style podcast that highlights the careers of passionate people who work in public service, including police officers, firefighters, EMTs, physicians, and nurses. For my listening audience, feel free to drop me a chat in the comment box if you have any questions for my guests. So today, I have the honor to introduce to you a new direct primary care medical practice called Integrity Health Alliance of Elizabethtown, Pennsylvania. Welcome, Integrity Health Alliance. How are you all?
Very good. Coffee number one going down, so I should be firing in all cylinders shortly.
Awesome, Dr. Mike. I already had my cup, so right now I'm drinking water. I wish I had a second cup, but it's all good. Okay, so with me in the room, I have Nurse Sarah Thompson. I have Dr. Mike Knoll, and I appreciate you all being here. Thank you for joining me today once again. So I know a few things about you, and I just want to invite my listeners to know more about who you are as well. Let us start with the team captain, Dr. Mike Knoll. I see you have worked 17 and a half years in the major medical systems as an internal medical doctor. That's as long as I served as a cop, right? 17 and a half years, it seems to be the sweet spot. So you are also a beloved father, a husband, and a Christ follower, and that's something to be commended. Nurse Sarah Thompson has been a registered nurse for over a decade with various nursing experiences that include cardiology, urgent care, and case management. Wow, that is absolutely fantastic. So what I find interesting about Integrity Health is that you all are literally located on top of a gun shop. How does that happen?
One of my favorite sayings is that we as Integrity Health Alliance are protected under the Constitution and over a gun shop. And there's no accident that the Second Amendment was the Second Amendment on top before or right after our freedom of speech, because there is no freedom. There is no freedom of speech if there is no Second Amendment to be able to protect yourself against tyrannical governments. And what you're doing here, really, if you think about it, you're doing First Amendment rights. And God has set up this whole internet thing. And I know most of you think that Al Gore did, invented the internet, as he had said at one time. But really, this is where the meat is that we have the ability to speak to people about what's going on in the world, where our freedoms are limited. And people like you and I and Sarah, who have devoted our lives to various things because of tyrannical governments, have lost our livelihood. But for what man has meant for bad, God has made for good. And I saw myself retiring from the hospital. I worked my 100% of the time in the hospital. I saw myself retiring from there, 6-figure salary, easy money, and that was not to be. And it was shocking. It was scary. But now the blessing of what we're doing here under the guidance of God, I never take for life. First of all, Sarah and I are 50-50 partners. I couldn't do without her, and she couldn't do without me. But more than that, God is the one who has put this before us. And whenever I have even just an ounce of fear, because there is fear, there are government agencies that could, just, even when you're 100% right, they can put roadblocks in front of you and stall you down. Um, but, we just know that God has put this before us, and what He has called us to, He will see to completion. And it's a great thing. And I don't care if I don't make what I used to make money wise. But God is in control, and that is the best place in the world to be, is in the center of His will.
Well, Dr. Mike, I really appreciate and love what you said for having a servant's heart. And it's all about compassion. And that's why we're here today. And also, I applaud you for standing up for constitutional rights, because it is about our civil liberties at the end of the day. So I commend you. In the Dr. J Talks podcast, definitely applaud you for that. So let's talk more about your practice. You provide quality one-on-one time at each visit, remove the barriers of insurance, right? And you also prescribe a lifestyle approach to health, and you even pray with your patients. Wow, that is very unique. We don't see too many medical practices in the United States that offers these type of features. And that's the reason why I definitely want to sit down and have a one-on-one conversation with Dr. Mike and Nurse Sarah for my Dr. J Talks podcast listener crew. So, Dr. Mike, you're going to have the first question. You all ready?
I'm ready.
Okay. So what brought you to the point where you have decided to start your own direct primary care practice? Do many physicians venture off like this?
Okay. To refer back to God promoted this, but for more specifics on that is, here I was working in the hospital, and when politically things were right for this to happen, all of a sudden I hear about a pandemic that starts in Wuhan, China, and extended into Italy. And then I hear it transferred from bats to humans. And then I hear there's a bat lady, that's what they call her, or bat woman, maybe, I don't know, bat, something female that actually exists anymore in this world. Um, but, and every red bell, actually, this wouldn't be a red bell, it'd be a red flag and warning bell was going off. And I immediately knew this was not science. It was political spin heading my way. And from that moment on, I was not very engaged, but I was very quiet about, what I suspected to be true. But when Penn Medicine, who developed the Pfizer vaccine, when they said they were the first in Pennsylvania to mandate an experimental vaccination, and this is what I in a recent writing I came up with. When you put those two words together, experimental or mandated experimental, mandate experiment, that is something that the Nuremberg Code, because of the Nazis working on Jewish prisoners who had no choice. And I can go into stories about how students who were 19 years old were threatened. If you don't get that shot, you'll need to pay back tens of thousands of dollars in 90 days if you don't get the shot. And my adrenaline was high. And I'm like, I cannot believe they are forcing people to lose their jobs or take this experimental vaccine, which is not a traditional vaccine. It was a brand new technology that we knew in oncology was dangerous. So it was a no-brainer for me. And two nurses reached out to me and said, Dr. Knoll, hey, if you want to do primary care, we'll work for you. I'm like, I never, ever, ever want to do primary care. I work in the office. Here I am. I'm loving it. But, God, just kind of like a division or a remnant, he pulls together people who are Christ followers who, and again, this vaccine has no pregnancy category. Pregnancy category is a very, very important thing. I would never, if a pregnant woman, yes, only women get pregnant. If a pregnant woman came to me and said, hey, should I take this medication? I would immediately find out what the category is. If I don't know the category, I'm going to call up an OB-GYN and say, is this safe or not? But the research was not done. So I couldn't even look at it. If certain physicians, if they were not 100% sure the government was going to protect them about any danger it would cause that woman and that woman's baby, they would never have said, take the vaccine. And here they are. They said, yes, you must take it. Knowing the government has their back and that they're absolved of guilt. But as you and I know, the government's not our final judge. And when I get to
Amen to
heaven,
that. Definitely.
and when I get to heaven, I know God, I will not be ashamed of what I did during this time. I will be so happy that God opened up my eyes, because there's some kind of blindness out there. I don't know why people choose to be blind. Is it just sin? But these are really good people who I love, who are pushing this thing. And so did I answer your question? What prompted me? Basically that was it.
No, Dr. Mike, you actually did answer my question, and I appreciate it for you elaborating on those specific details for the Dr. J Talks podcast crew. So, yeah, going back to the height of COVID, unfortunately, has significantly divided this country in half. It has caused people to stand up for religious and medical freedoms. And just because folks do not want to get the jab, the COVID-19 vaccination does not make them a bad person. It doesn't make them evil. In fact, I commend anyone who has enough gall to stand up for their constitutional rights. And like I said, if someone wants to get the COVID-19 vaccination, I don't particularly care. That's their body. It's their choice, whatever. But do not infringe upon my civil liberties and my constitutional freedoms and mandate that I take a stupid vaccine. So I appreciate that, Dr. Mike. So Sarah, let's talk more about the medical practice, because that's why we're here, right? We're very excited about the show. I'm just thrilled to know more about you. Everyone knows that you are my beloved wife. See, y'all didn't know that, Dr. J Talks podcast crew. This is my beautiful wife, Sarah Thompson. It's definitely great to see you again, sweetheart. All right, so Sarah, I have a two-part question for you. Perhaps you can shed some light for my Dr. J Talks podcast crew. What does direct primary care mean, and how do you provide that service at your clinic? Can you break down a little bit about the DPC model for my listeners, please?
Sure. So most people are used to hearing a primary care. So they understand what a primary care doctor does, what they are able to offer at their office. The direct primary care, what that means is it's a direct relationship from the patient. Here we call them members because we do a membership. So from the member directly to Dr. Knoll. We're cutting out insurances, so the pay goes directly to Integrity Health Alliance. There's no middleman, there's nobody in between. When somebody comes in for a sick visit or a chronic management visit, they're speaking directly to Dr. Mike Knoll. All that communication goes strictly through him. He's doing his own vitals, he's taking his own notes, doing his own charting, and that's where the direct comes from. It's that direct access to the doctor, to having medical choices and freedom. He's able to sit down with people and talk and give them true informed consent and say, these are your choices. Is this something that you want to continue to do, or and lay everything out on the table and come up with a good game plan. Something that is missing in the medical system today. This is your option, you do it, or you're banned. And that happens, unfortunately, quite a lot. So that's where the direct primary care comes from. It is a membership model, so it's kind of like going to the gym, right? You're paying a monthly membership to go to the gym. It's like that. Some people are like, I'm not used to this model, and they're right. In the medical field, we aren't used to this model. We are very conditioned and very used to insurance. But if you think about it, we do have a model like this that we're very, very used to. So think about your car. How do you take care of your car? You have a high deductible car insurance that if something should happen, God forbid you're in an accident, you know that you can replace your car, right? Some people pay that an annual fee. Most of us pay it every month. Let's say $100 every month. We know we have high deductible car insurance. But then everything else is on us. When we want brakes, we take it to the garage. We can shop around, right? We can go to garage A, B, C, or D, whoever we feel that can give us the most competent care for our car. I don't call my insurance and say, hey, I need gas for my car. And they tell me, well, guess what? We're only going to approve $25 at this Wawa down in Philly, even though we're in Lancaster. And that's a comparison to what current insurance is doing. Insurance is mandating to doctors when they say, well, we feel that this is the best medication. They're like, oh, no, we don't. And it's this back to back. You'll hear them say, well, I have to do a peer review, and it takes hours, prior authorizations. But in this model, it really gives the doctor the control, the autonomy to practice medicine that the way they've been taught and the way that's on their heart, and to really sit down with a patient, with a member, to come up with their own care plan, basically.
So that service piece that you're mentioning involving Integrity Health and a DPC model sounds very interesting, and I'm pretty sure it's going to excite a lot of people. But I have another question for you along those lines. So let's say, you may have someone now who currently is out there working, they have medical insurance under their job. If they were to transfer, let's say they wanted to come to your practice and become a patient, would there be any conflicts between their medical insurance that they currently have and transitioning to Integrity Health? Just want to clarify that for my listening crew.
Sure. So the first clarification is we are not insurance. We are not a health plan. We're not insurance. We only do medical care. So again, this is where the autonomy comes to every person. I can't direct people to say, you must do this, you have to do this. Every person has to sit down for themselves and say, this is our budget, this is what we feel comfortable with, this is our current medical situation. So they might have a lot of health issues and might do better keeping full coverage plan. Other people might be extremely healthy and just want a high deductible that, say, if something should happen, they need a hip replacement and they would have to go into the hospital, it would be covered at that point. Again, it is something that it gives you, every individual, their own autonomy to sit down. We can definitely guide. I can give options. We work with Blue with Health Savings Accounts for America. And so there's different options that we can guide people, but the most clearest thing is we are not insurance. We are not a health plan. We are just direct primary care. So just doing that medical care of things. But yeah, people can keep whatever insurance, but it makes us accountable and makes us very aware of where we're putting our money.
So thank you very much, Nurse Sarah Thompson. I appreciate that. So just for my Dr. J Talks podcast crew, for clarification, Integrity Health Alliance It's not an insurance-based practice, which is absolutely fantastic. It gives you that other option. So also, in light of that, is there a limit on how many members may sign up to Integrity Health? Let's say if I have 15 kids, I want to bring them all to Integrity Health. What does that look like?
Sure. We have an upper limit for Dr. Knoll. We're thinking about 500 before we start looking maybe about onboarding another provider. But yeah, if you have 15 kids and you're able to pay the monthly membership, we have no problems. We do have family plans. We have individual plans. We're very, very close to 200. We're at 195 as of this morning, which is amazing. That's all thanks to God.
That's awesome.
It is very awesome. So yeah,
Okay.
that's
And one thing I want to add on of a difference, that a change that I had made mentally about what Sarah had just mentioned, about how if a person has a lot of medical issues, chronic heart disease, kidney dysfunction, liver dysfunction, like a steatohepatitis, or there's a lot of medical issues, diabetes. I thought, a person like that, needing a lot of medications, a lot of specialists, they might be better off going to the conventional medical practice. But then that's where my change of thought came in, is basically they need to pay the membership fee. If we order any labs for them, they can submit that to their insurance. They can, go to the pharmacy, get
So
their
they
things
still do
off.
have the option to submit certain labs to their
Yeah.
insurance company. Okay, that's great to know.
But the more important thing is this: when you go into your primary care physician, they're going to deal with one issue. If you bring up a second one, because they can only, and I'm not faulting them at all. This is the broken system that's out there. They talk a lot about doctor burnout, and it's true, because the doctors have to see. We said about having 600 to 700 people in our total profile. They need to have 1,600 to 1,900 in their total profile.
Wow.
And face-to-face time, all they can have is 10.7 seconds is what it came out to be when you subtract, what the chart.
That's incredibly low.
That is low. So we spend a lot of time with our patients. Plus, the people who are drawn to our practice are people who have lifelong taken care of themselves. So we have a lot of people we don't really need to see that often. So that gives us time to focus on those people who may initially need more time, but hopefully when we get them stabilized and get them on a good lifestyle, stress management and all that, they actually, I think, will do better with us, because we can deal with all the issues and what are all the different specialists saying, and make sure there's no conflict. Whereas their primary care doctor, that I don't blame them. They just can't do that. They're in a broken system that needs to be rehauled.
Which leads me to my next point, which I really enjoy about Integrity Health, because it seems like you have all a sense of purpose. You have a vision. You're very mission driven. And that's something that to me is going to attract many patients to your practice. But it's not about a numbers game in my thoughts, right? It's more about being able to provide quality healthcare services and making people feel that they're included, that they belong. I can remember so many times just going to the doctor's office and I'm sitting in a chair, right, and waiting for so long just to be seen. And when I get to the front desk, I get an attitude. But it's not going to be the same at Integrity Health. And that's what I really appreciate about you all. I have another question for the team captain, Dr. Mike. So in light of what you just said, a lot of times patients, we quite don't know where we're going for medical treatment. So can you just maybe briefly elaborate on the big picture? What is the big vision? What's the end game for Integrity Health Alliance? What does that look like for the average person who may know nothing about your practice, but they're inquiring?
The end game is, um, that's a good question, because I have an answer in my head, and maybe there's others, but one of the answers is, a guy comes into me the other day, a very healthy guy. He actually looks physically fit. He could probably
Mm,
stand to lose a couple pounds, eating a decent diet, and he's on 3 blood pressure medications. And we ask everybody, what's one of your goals? And he says, to come off of my blood pressure medication.
mm,
In the traditional medical practice, the conventional one, the insurance-driven practice, that would have been like a laugh track would have come after that. Like, oh yeah, that's good. You're going to come off your blood pressure medication. Yeah, we're fine. But that's the truth of the matter. There's a guy, Dr. Mark Hyman. He wrote a book called Food is Medicine. Very famous
mm,
guy. Works for the Cleveland Clinic. And he said he had a woman who was morbidly obese, liver failure from fatty infiltrated liver, metabolic syndrome, heart disease, all this stuff. He said, first of all, they eliminated dairy, gluten, and refined sugars, and she within 1 year lost 130 pounds, and
mm.
all those chronic illnesses went away. Here's our goal. Our goal is, God has made us and given us a body that is unbelievable. It has the capacity to heal itself, as long as we allow it to have the proper environment to do so. And eating whole foods, avoiding GMOs, even things that come in your tap water are harmful to you. So having reverse osmosis, filters. So I guess I think I've swerved into the answer is, our bodies are very complex,
Mm.
but if we, number one, we are Christ-centered. Uh, having your life uh, under the umbrella and protection of God, and then the next thing you would think about is your stress level, getting rid of toxic relationships, dealing with micro traumas that you're carrying with you, getting rid of anger that you have in your heart.
And those are
And
really important issues, Dr. Mike. I didn't mean to cut you off, but you said
I'm done.
something to me that stood out about managing trauma, stress, anger. These are the things that we experience every day in our lives. I mean, real people. When I was a cop working down in Baltimore, I had to go to a psychologist, but I was afraid to actually bring that to the forefront and let people know that, yes, I needed help because I was experiencing so much emotional trauma and burnout and pain and suffering that I felt like I didn't have a professional outlet. So the very fact that people can come to Integrity Health and be treated like human beings is absolutely phenomenal. And it goes back to my point prior about the one-on-one patient care and ratio, right?
Mhm.
But it's also something that's very interesting, given the fact that we've come out of COVID, now going on year 3, just about. There's something called informed consent, and many of my Dr. J Talks podcast crew here locally in Pennsylvania may have some concern about getting that jab. And I know Dr. Mike and Sarah, you had mentioned that at the beginning of the podcast, but if you don't briefly remind our crew, if they don't want the jab, the vaccination, you're not going to force them necessarily or recommend it, correct?
Go
Like,
for it.
a softball. I'm like, who's gonna slam this one out of
That's a
here?
softball question. Come on.
Yeah, yeah, yeah. So and I have to say, I recently met an oncologist, and I'll just leave it at that. Um, I've had such close friends who are oncologists, and I was like so shocked that they were pushing this uh, genetic immunomodulator. It's not a vaccine, okay? It is, uh, the traditional vaccines. By the way, I'm starting to question whether those are of value either. Particularly, definitely the smallpox. there's no animal reservoir for smallpox. That's why there's a vaccine. Once you get rid of it from the population, it's gone. And so, in very specific circumstances, a vaccine could be protective to a person who's going into an environment where that's endemic, a particular thing. Ebola. If I'm going to Africa where there's Ebola, if they have, and I'm fairly certain they have a vaccine now for that, I would take it. I would research it first, let's put it that way. And then if it seems like legitimate, I would go with that. But in this situation, it's going into your body, and they told you they would shoot it into your deltoid muscle. It's mRNA. It tells your ribosomes to make spike proteins. That was my first concern. Like what? Because when I was in the hospital during all of COVID, I knew that this virus was different than any other virus. And one of the major reasons why is because the spike protein was interacting with a receptor on the blood, the blood vessel lining, causing all this cytokine storm, which is inflammation and blood clot. I'm like, spike protein is why the big question, why is this happening? And everybody knew it was the spike protein. And then the moment they came out with this vaccine, this shot, they immediately said it's prothrombotic. So, I mean, even though I knew it was making the spike protein, on top of it, they're saying it does exactly what the disease does. But they're saying, okay, 20 minutes of it, it's gone. You got the immunity to it. I'm like, okay, a brief 20 minutes of a spike protein, whatever. But I was not convinced of that. And studies show that 9 months after the shot, and I'm not sure now longitudinally how much they do have the data on, is it still producing? Not only is it being produced, the mRNA or the protein being produced in the deltoid muscle, but in every organ of the body, still making a spike protein. So categorically, I would say you should not be taking it.
I appreciate that, Dr. Mike.
But that's my belief. It's not the CDC's belief. It's not the WHO's belief. It's not the FDA's belief. But, a lot of things that we believed and we're called conspiracy theorists, they call that fact now. So, I believe we're ahead of the curve. But that's where you were bringing up informed consent. You know what? I'm going to tell you this. And I believe that it is not good, and that nobody should be taking this. That's my belief. And I have the right as an American citizen, as a child of God, to have my own belief. I'm not telling anybody what to do. That's what we have the free country for. If you want to take it, you go at it. And we don't administer it here, but, and we're not going to discriminate against you.
Well, that's what I love about your practice, that you are so open to what other people believe in their constitutional freedoms, and that's what it's all about. Even though there may be individuals who said, look, I'm going to take the vaccination, this is for me. Well, more power to you. But again, I just want my Dr. J Talks listeners to know that Integrity Health is not promoting the COVID-19 vaccination, and that was well said. And it was reasonable. You talk with so much common sense, Dr. Mike. I appreciate that. So moving right along, I do have another question for Nurse Sarah Thompson. Your practice also partners with a functional nutritionist, a physical therapist, and a fitness instructor who could not be here with us unfortunately today. But can you, or maybe just describe their roles and what is that all about? I mean, you have a physical therapist, for crying out loud. Talk to us about that.
Sure. So when you're looking at the entire body, you want to make sure that one of our missions and goals is to keep people well and healthy. Part of that is looking at the entire body and saying, okay, what is needed to keep people at their baseline? And thankfully, God has brought many like-minded, patriot, Christian people into the realm who are running their own businesses. So we're partnering alongside of them and with them. So their services are not part of the monthly membership, but we are able to refer to them. They meet many of our members here, so at Elizabethtown at the clinic. So it's wonderful. But we have Tanya Jarrett, who is our functional nutritionist. He's been doing this for over 10 years. Great, great presence and great knowledge about how, like Dr. Noel was saying, how food is medicine. Um, so that's something that you can do. Physical therapy, we have Zach Mitchell. He is from the Ephrata area and really believes that God is calling him to keep people at their baseline. Great reviews from multiple of our members that have utilized the services of, I was hurting when I was doing normal chores around my house, and I had one meeting with him, and I'm doing so much better. But again, anyone that we partner with has the same mindset that we do. So instead of a physical therapy appointment that's only 15 or 20 minutes, he's taking an hour to an hour and a half, maybe not quite that long, but about an hour at least, and really focusing on what that patient is. He comes in with a little bag, and he does what God's called him to do, which is really amazing. And then we have Miriam Aki. She is a personal trainer, but again, God has called her into a ministry of exercise. She feels that
That's
she wants
awesome.
people moving and loving to move, not just finding it being a chore, but finding their niche in this world. And that's what I love partnering with all of them. That God has given us all talents, different talents and gifts, and He's really pulling us all together under one roof, which is amazing.
No, thank you so much, Sarah, for telling my Dr. J Talks podcast crew about that. You remember back in the day when I had gotten injured down in Baltimore dealing with a suspect. And I can honestly tell you, one of the people who helped me to get through my injury was a physical therapist. In fact, I did pool therapy, which was pretty cool. So anyone out there who is interested, maybe have a prior old injury and they need someone to just work with them, check out Integrity Health Alliance of Elizabethtown, Pennsylvania. Okay, so I know, Dr. Mike, you're a pretty humble guy. You don't like talking about yourself a lot, right? But I'm going to ask you the question anyway for my Dr. J Talks podcast crew. What makes you different than most physicians out there? Because after all, people decide, right? They want to know, hey, why should I choose one place over the next? And maybe, Sarah, you can chime in a little bit if Mike doesn't want to necessarily answer this question. But what truly makes this man, this doctor, different than anyone else?
Gray beard. The gray beard goes a long way. When I was in the hospital, sometimes these demented patients were acting out, and it wasn't even my patient. I would just walk into the room with the nurse is struggling and say, "Hey, I'm your doctor." Settle down. So the gray beard does help quite a bit.
So they respect the wisdom. I'm stroking my gray too. It's coming in slowly.
Yeah. But what I have to say is, I became a believer in Jesus Christ in college. Prior to that, kind of going to whatever Protestant church was near, and just didn't live my daily life under the lordship of Jesus Christ. So that happened in college. And ever since then, I really do believe God has given me a gift of faith. And I did look that up one time, and that is actually a gift. And I just don't doubt of God's existence, of His working in our daily lives. And really, I love nutrition and exercise. All of these are things I love. And I love, above all things, the truth. I love truth. People lying, and God, is written. I think is it seven things that God detests, and
They call that the seven deadly sins, right?
yeah, and there's there's two of them on there. That one is giving false witness, and the other
Mm.
one is deceitfulness. So two of them are lying. So God really does not like lying, and I am just so over the top with telling the truth. So there are some things that some of my members are coming to me with, that they've been doing for as far as, let's say, alternative treatment, and I'm like, I don't know where the power of that's coming from. Is that because Satan has the power to heal too. So my desire is to keep this so godly here, to allow God to heal us. And I'm a terrible businessman. I don't want to make money, which is terrible. I, I'd like to keep my same level of which is fairly humble, lifestyle. But it's like, what was I going to about truth? Is
Why?
I
Different than any other. Why
yeah.
would
Is it, I'm going to
You were discussing about lifestyle and truth, and I think you really laid it out well, Dr. Mike, for my podcast crew. And it goes to show you just how much of a person of integrity you really are. And that's the main reason why I asked that question. See, I brought it out of you slowly.
yeah, yeah.
Okay,
Because
so
I don't have any choice but to have integrity. It's
mm,
just part of what God has put in me. And there are people out there who see the Amish, and the Amish are very cash heavy, so they can pay for a lot of things, and they'll pay thousands of dollars for supplements that the provider is only spending a minimal amount. I just can't get I want to be, when there was thought about what program we would do, there is something called concierge medicine that deals with very rich people. They have a much higher membership fee, and I have no desire for that. I just want to have the average middle American, middle income person, even poor people, if they aren't able to afford insurance. There's people here who are coming here who have no insurance at all. They're doing everything cash pay, and they're going to have a hard time finding another provider who's going to just take them in as cash pay. But now they have paying the small fee. I'm on top of the mountain walking my dog, and I get a text, hey, I think I might have a bladder infection. I can dial in a prescription, and it'll be there in 12 minutes for that patient. They have the instant access to us. And I guess that is kind of what drives me is helping people. It sounds very cliche, but as you know, having been in the protecting, protection.
absolutely. No, I get what you're saying, Dr. Mike. It makes a lot of sense to me, and I'm thinking it's making sense to my podcast crew as well. One of the reasons why I wanted to go in that direction is because so many of us at times we feel that there's no one who cares, right? We show up at a medical practice, we're in pain, probably the worst friggin' pain of our lives, and we're literally dying here seeking someone to reduce whatever is going on inside of our bodies. And that sort of leads me to my next question about long wait times. Now, I understand that certain medical practices, there's something called a triage system, like you already know, coming out of the hospital. But maybe Nurse Sarah, if you could walk us through the process, what is like coming to Integrity Health right here at Trop's Gun Shop when the patient exits their car, they take the elevator upstairs. Can you sort of walk us through that scene? What does that look like so our listeners can know more?
Sure. So let's say somebody has signed up. We get them in for an initial consult with Mike here, and that typically is about an hour and a half of going over their medical form that we have them fill out, coming up with a good game plan. Our form is very inclusive of their entire life. We ask occupation, stress level at home, stress level at work, what they eat,
Mm.
surgeries, family health. We ask a lot of different questions. So, Mike listens through their lungs, checks their bellies, does the medical side of things. But really, when they come, there is a front desk there. Sometimes I'm sitting there, but a lot of times Dr. Mike is the one opening the door and, really having that interaction with them the entire time. Let's say once they become a member and they are sick or they need to come in for like a diabetic check or a blood pressure check, um, especially when you're sick, we can get you an appointment within 24 to 48 hours of you calling, and we've been able to do that. Um, and then with chronic care, some people are scheduling, 4 weeks out of, hey, I'm going to come back and recheck my blood pressure. But again, in this practice, it's not a doctor directed, you must do this. You must come back in 3 weeks. We have somebody who is monitoring their blood pressure every day, and we got a call last week. And I think it's time for a checkup. I want to come in and go over blood pressures again. And it's something that Mike is sitting down with the members and coming up with a good game plan. It's both people being on the same page and not just sitting here. So when you're here, you have to be responsible for your own health as well. And it's that collaboration part that is really different.
Well, thank you, Nurse Sarah. I really appreciate you explaining that and walking my Dr. J Talks podcast crew through the process of becoming a patient at Integrity Health Alliance. There's always going to be a soft spot for the medical profession, even though I did not come out of that, right? I was a cop down in Baltimore for 17 and a half years serving the public, but I can always remember the times when I encountered someone with a mental health condition or going through an emotional crisis. I had an extra soft spot for that sort of thing, being that my mom, who's no longer here, God rest her soul, she served as a phlebotomist and drew blood. So as a kid, I watched her literally, take the needle, put it into people's arms, but she did it with such compassion and care. And that really stood out to me. In fact, it probably is one of the reasons why I wanted to become a public servant. So to my Dr. J Talks podcast crew, visit the Integrity Health Alliance website is a must. www.integrityhealthdpc.com. That is www.integrityhealthdpc.com. And I'm also looking at some really cool features that Integrity Health Alliance offers, which is acute and non-acute office visits, preventative care, metabolic balance, personalized nutrition, chronic disease management, diabetes, asthma, high blood pressures, sports physicals, blood pressure monitoring, diabetic monitoring, pulse oximeter, and even breathing treatments. This practice is absolutely phenomenal. Okay, I cannot end the show without restating some of the cool features that your practice has. Let me tell you, when I walked in for the first time, I was highly impressed. Now, being the fact that you're on top of a gun shop and being a former cop, it all really meshed well with me. It was really cool. But this facility that I'm currently in, it's really fashionable. I mean, it looks like state of the art here. It's a modern facility. It has coffee for guests, comfortable sitting chairs, a juice bar, a catering kitchen, a television, and even an exercise sauna. Really? In Elizabethtown, Pennsylvania, you have all that for your patients, do you not?
And part of the thing that, again, it was a God leading, is I wanted to make this not a place where you go into the waiting room, go up to the second window of the drive-through, open a little glass, get your thing, write your name, sit on the cold plastic chair. And even with DPCs, they continue kind of that model. And then you go to the little room and you have your exam and whatnot and talk. And with DPCs doing it in that way, they do spend more time with you. But it's just the same thing as you walking back out, with what the plan is. My thought is to make this an environment, a community that you support one another, and you come here, you fellowship with one another. On Fridays, starting July 7th, we're going to have a First Fridays where people bring in their own nutritious food with recipes. We're going to have I think we do every other Saturday, a walk with integrity where we walk together on a trail.
And not to interrupt you, Dr. Mike, but I have to go back to that point. So you mean to tell me it's going to be like a medical practice potluck? People get to come in and present their healthy food options. And not only that, I believe I may have missed this or maybe heard it about canning. You even teach people how to grow their own food?
Yeah. So,
amazing.
So many of our members do canning, do vacuum, or what is called pressure canning, vacuum sealing, dehydrating. And we recently got connected with a gentleman who his specialty, 72 years old, his specialty with an incredible resume for emergency preparedness. Let's say an EMP, electric magnetic pulse, which is technology that's available. If that would go off to fry the grid and we had no electricity, 90% of the people are going to die because they rely on water being pumped to their house with electricity. They rely on sewer systems. They rely on the supply chain for food. It would be a very scary thing. And
Sure.
the last thing we want is scariness in our lives. And it was Louis Pasteur who said, luck favors the prepared. So we want to be prepared as God tells us to prepare. What was it, was it Joseph and Egypt, where he got them prepared for the famine coming, right? So that's what we need to do, is be prepared. One other thing I just want to throw in real quick.
Sure.
Our job is to keep you out of urgent cares and ERs. A study was done that showed 80 to 90% of the people in ERs could have been managed at their primary care. And again, I never blame the primary care. It's a broken system. A friend of mine went in and had a laceration on her finger. They're like, "Ooh, that's getting stitches." She goes, "Yeah, I thought so too." They're like, "You'll need to go to an urgent care center." And it was $1,000 plus later, where she had to get the stitches done at the urgent care center. We have oxygen tanks ready. We have nebulizers. We're going to be administering IV fluids. Minor procedures, removing skin lesions and things like that. Things just to keep it all in here, so that you don't need to go out there and interact with people who are less than kind to free thinkers.
Well, thank you so much, Dr. Mike, for explaining that. I appreciate Nurse Sarah for walking us through that process. So for my listeners, I think it's a no-brainer at this point. It is self-evident. I honestly believe that Integrity Health Alliance has made their point crystal clear. How they care for your health. You are more than a number. So to my listeners, if you or your family want to join a medical practice where you are treated with compassion and provided quality medical services, please sign up today with Integrity Health Alliance at www.integrityhealthdpc.com. That's www.integrityhealthdpc.com. You can also follow the Dr. J Talks podcast or email me, hashtag Dr. J Talks. Email me, drjtalks@gmail.com. And if you would like to support the show, please visit my webpage and you can click on the Cash App for further. Dr. Mike and Nurse Sarah, we are running out of time. Do you have anything else to say to my Dr. J Talks podcast crew?
I just think this is where our hearts are. This is the gifts and talents that God has given us. But ultimately is we care about your relationship with Christ. And if you don't have one, that we continuously point people to Christ. He is our Savior. He is our Lord. And, we know we're not for everybody, and that's okay. but we encounter so many people, and that is our heart's prayer, that if they don't know Christ, that God will reveal himself to them, that they do have a relationship, because this is for eternity. And even though it seems like we're doing it right now, pointing people to Christ is always for eternity. So I think that would be
one thing when you were talking just now made me think, many people who might be listening to this have done the hard work. They have stood up against unbelievable pressure and say, no, I'm not all right with this. And they stood up and they stood strong, as we did as well. But I'll tell you, there are people in the hospital who I love as colleagues, and they unquestionably have done the wrong thing. When a person comes in with a vaccine injury, to not even mention it, even if they say, hey, it could be this, but it's probably not, but they completely ignore it. And as much as I love them, I have to walk away from them. And similarly, if you love your practice, where you get 10 minutes of FaceTime, and I love my primary care. I'm still going to him right now. But there comes a point where you have to say, we need to defund the broken system. It's dying, but we need to maybe accelerate that. And I don't say that in a mean way. I have to say, as long as you continue funding them, they're just getting more and more money from to keep this dysfunctional system going. And sometimes you just need to walk away, even though you love your primary care. I'll tell you, I can't tell you how many people say, I've been going to this guy for 30 years, but only in the last few, he doesn't even look at me. He's just tapping in and maybe doesn't even do an exam on me. So pressures have changed, and it's changing these people too. Because when they know that you have a second thing you want to say, and they have to say, cut you off and say, listen, making another appointment at the earliest available time. Yeah.
And Doc,
and that's not just us saying it. There's many different companies out there who are saying if the health system does not change the way we currently are going, in the next 20 years, it will take an entire household income just to pay for healthcare. And DPCs, even though it seems like a new idea, they've been around for the last 10 to 15 years. Prior to that, it was a fee-for-service model. The DPCs have been around for the past 10 to 15 years. In 2021 alone, DPCs have exploded at a 21% growth rate, where your traditional primary care through the insurance model has decreased by 10%. So it's not just us. There's plenty of other physicians that are leaving and starting their own direct primary care because they see how broken this system is. And so really, if people want to be in the forefront of the next best thing, and really making people accountable, healthcare, hospitals, other doctor offices accountable for how they present medical care, it is having multiple independent practices around again.
Well, I thank you both so much. Were you going to say anything else?
Nope. I said that was great.
I thank you both from the bottom of my heart for doing what you do. It takes a special group of people who are dedicated, who are loyal, faithful, and have mental discipline to meet the needs of others. You are truly both a beacon of light in a very dark world. Dr. Mike, I listened to you through the entire podcast. You've mentioned one word. Not sure if you heard yourself on this. You said broken. Yes, we do have a broken healthcare system. Anyone who's considering an alternative, a change, please sign up and visit Integrity Health. God bless you all. I appreciate you. To my Dr. J Talks podcast crew, I will see you next time. I'm going to let this beat ride out. Peace. You are listening to the Dr. J Talks podcast.